Hi, I am Dr. Praveen Kumar M, Consultant Rheumatologist at the Daivik Arthritis and Rheumatology Center. So what is fibromyalgia? If we break fibromyalgia into two words, fibro means fibrous tissue which is present in the body. Myalgia means muscle pain. So it is one of the common condition which is usually mistaken for arthritis. So it is more common in young females, usually of less than 40 years of age. Rarely even children also can get. So what are the symptoms or the complaints? Patient may also have a low mood or irritability. About 1/3 of the patient with fibromyalgia will also have a depressions. So other symptoms include headache, chest pain or pain abdomen, or they may have a irritable bowel syndrome, which is nothing but a diarrhea or a constipation, pain during the defecation. So these are the other symptoms. So usually these patients will have multiple doctor visits. Usually they come up with a normal investigation. Whenever they visit the doctor, usually they will be told that they will have nothing abnormality in the blood or imaging. So they will have multiple visits to different specialty of the doctors. So what are the common complaints of fibromyalgia? Usually the patient with fibromyalgia comes with widespread body pain. Usually the pain in the arms, thighs, legs, which will affect their day-to-day activities. So they may also have a overtly sensitive joints or a muscle stiffness, which will be usually more in the morning and also sometimes at the night. So they may also complain of low mood, pricking or a burning sensation in the feet or the hands, and also the unrefreshed sleep. This is one of the common complaints they usually come up with. So what causes fibromyalgia? The exact cause is not known, but there is a common link between any traumatic event in the life or a depression and mental well-being. The stress used to increase the symptoms of the fibromyalgia. The patients with fibromyalgia have a low pain threshold, meaning patient could feel the pain with a small amount of the pressure or a touch, which could not elicit the pain in the normal individuals. Usually patients with fibromyalgia will have a poor sleep, unhappiness, low mood, stress, all are known to increase the pain in fibromyalgia. How to identify fibromyalgia? Clinical examinations along with the detailed analysis of the cases will help to suspect a fibromyalgia. We run a series of the blood tests to exclude the disease which mimics the fibromyalgia, like arthritis, myositis, or certain metabolic bone diseases. And also a clinical questionnaires which is filled by the patients are also valuable to arrive at diagnosis. Treatment: even though fibromyalgia will lead to a pain all over the body, it will not damage the tissue. Symptoms are usually controlled with a combination of the medication, physical activity and behavioral techniques. Antidepressant medications are helpful if the patient has a predominant depression. So usually anti-seizure medications are given or preferred if the patients have more of sensory predominant complaints. Along with that, physical therapies, which includes low-grade supervised aerobic exercise, are valuable in managing the fibromyalgia. Behavioral techniques like planning or pacing the activities for a day or a week are helpful. Reserve your time for pleasurable activities like music, games. Avoiding the activities which will increase the symptoms such as emotional exertion, stress, lack of sleep. Patients with the fibromyalgia will have inadequate sleep. They have a very poor sleep. Having good sleep is very important in the management. So you should follow a sleep hygiene. Few tips for a good sleep. Keep a regular sleep habits, meaning that you should go to the bed at a fixed time and also you should get up from the bed at the fixed time, even in weekends and holidays. And you should not consume alcohol, caffeine in late afternoon or within 3 hours before going to sleep, because this caffeine or alcohol can wake you from the sleep or also keep you awake. Doing a exercise about 30 minutes daily increase the quality of the sleep at the night, but you should avoid exercise within 3 hours before going to the sleep. Avoid daytime naps. Sleeping in afternoon or late afternoon will decrease the sleep in the night, so you should avoid a daytime naps. Reserve your bed for sleeping. So you should avoid using your mobile or reading a suspense novel or any other activities on the bed. Keep your bedroom quiet, dark and cool. Avoid liquid and spicy meals before the bed because it can cause heartburn or a gastric, which again wakes you from the sleep. So these are all helpful tips in the management of the fibromyalgia, and it is one of the disease where doctor and patient should be discussed about the managing the disease. Thank you.